Hello, Nursing 470 students. My name is Jessica Bunting, and I'm going to give you a brief presentation on what I did my community healthcare project on, as well as the population that I presented it to. So for my topic for my community healthcare project, I presented a presentation on undiagnosed mental illness of individuals who are 18 years and older. My presentation took place at the Marion County Health Department during one of their monthly meetings. The audience that I gave my presentation to, it consisted of approximately 15 members of the Marion County Health Department. There was 13 females and there was 2 males. All were of Caucasian except for one African American. Every member had an associate's degree or higher, and ages ranged from anywhere from mid-30s to early 60s. To begin my project, and I also did not see any learning barriers physically or mentally. So to begin my project, I started my project off with a PowerPoint presentation in which I compiled numerous slides. I started off basically discussing what mental illness was, how members within the Marion County were affected by it, and who was affected by it. So we explored a little bit of the whole population that was affected by mental illness and who may be undiagnosed. Then I went on further of, there's different studies and statistics that I went over. So first I went over different statistics. I went over a lot of different statistics within Illinois and nationally. I could not find any within Marion County, so I focused more on the ones that I could find from the state of Illinois. And then I also based a lot of my knowledge off of the National Alliance of Mental Illness, which was also known as NAMI, and the World Health Organization, as well as different articles that I had found from sources such as the American Journal of Nursing. After finding these different statistics, I basically gave a rundown about who within Illinois was more prevalent or more prone to getting mental illness, what one of the top mental illnesses was, which was depression. Women were more affected. I explained these different factors, and then we went into more depth after statistics about different studies that had been found effective that had took place in the past. Some of the studies may have been based on, physical activity, exercise, diet, counseling, technology, even with the use of smartphone apps or applications. I had explained these type of studies to my population or my audience that I provided the presentation to due to the fact that a majority of the members were nurses. A lot of times when people think of mental illness, they think of medications. They think of, oh, let's prescribe this person a benzodiazepine or, something for depression. No matter, it's just based on whatever diagnosis they're on, just a medication. Well, nurses, we can't provide medications. We can provide different treatments such as encouraging exercise or encouraging a better diet, or different, like I said, smartphone applications where we can do deep breathing exercises or create a cognitive journal of our thoughts and feelings and how we can reflect upon what's realistic and not realistic. I wanted my audience to learn these different approaches because it was something that they could actually enact as a patient's advocate. So after going over these different studies that I felt as a nurse that they could actually make realistic and put into place, I started discussing the different barriers to treatment. So some of the different barriers that I discussed was lack of transportation, maybe lack of education, whether it be the patient or knowledge of the doctor, maybe the cost. And the big thing I found was social stigma. And so we talked about social stigma, how a lot of times people with mental illness don't want to seek treatment because they feel like they're judged. They feel like people look at them like they have some kind of contagious disease or like they're crazy, when they're not. So we wanted to know I wanted to teach my members how they could overcome this barrier and what they could do. So I gave them knowledge base about just simply treating somebody like they were a human and talking to somebody, open communication, the reason why I picked the Marion County Health Department was because they come into contact with so many different people, whether it be infants, children, adults, elderly. They see so many different people. And a lot of times undiagnosed mental illnesses seem more prevalent towards early adulthood or even being middle-aged. They see a lot of patients within this age range, and I wanted to make that aware. I wanted to make them aware of that as well. So after going over barriers and discussing what they could do to overcome them, I also wanted to go over what resources were available in Marion County and what they could do to help the members that come into the health department that may be undiagnosed with mental illness. Because mental illness is really something simple for a nurse that's paying attention and knowing what to look for to not diagnose, but try, nurses have their senses. So a lot of things I went over, like different symptoms of, like depression or anxiety. And I went over these symptoms because I figured if they could pick up upon these symptoms, they could apply the resources that I'm getting ready to discuss towards their practice, and then they could kind of advise their patients to maybe seek assistance from these resources. So I went over the local resources that we have within the community. One thing I did before my presentation is I went to the Community Resource Center in Centralia, Illinois. It's a big resource within Marion County that I've just overheard before in the past, and I've seen people go to for assistance. So I went down there, and I originally went down there to find some local statistics about mental illness because I couldn't find any on the internet or even anything locally. I couldn't find any literature. So they actually didn't have any there for me, but they did have different information that I could incorporate to the audience that I provided my presentation to, as well as provide my audience as a resource whenever I was finished with my presentation. So when I went to the Community Resource Center, I collected some different pamphlets and a handout, which brought me back down to me providing my resources within my presentation. So whenever I went over resources within the community for my presentation, I discussed how I went to the Community Resource Center, how I collected all this knowledge. I presented my audience with 3 different pamphlets that I had arranged. There was 3 different pamphlets. One was based on suicide, and it was pinpointed for a patient who may have attempted suicide in the past or may have suicidal thoughts. There was a second second pamphlet about suicide that discussed more information about a family or a friend of a patient who may have tried to attempt suicide or have thoughts of suicide. And then there was another pamphlet more pinpointed towards the healthcare provider, explaining the same things. At the back of each pamphlet, there was a portion that provided different phone numbers, websites, different, either it be state or national resources of different organizations that could help with suicide awareness. There was different hotlines, crisis hotlines, different organizations that maybe different people who have been affected by suicide or even with thoughts of suicide could contact in order to speak out their thoughts or their feelings and seek help or assistance, as well as people's loved ones or even different healthcare members such as myself or members of the Marion County Health Department. I also provided a handout of all the mental health resources within the state of Illinois. I thought this was really prevalent because there was resources on this handout that I had never heard of, and I've always lived in Marion County. On there, what I did is I highlighted all the sources within Marion County, and then there was also all the remainders within Illinois. And I provided this, and I passed all this stuff around. I let everybody review all this, and then I also threw in another pamphlet that provided information about what the Community Resource Center was in Centralia, and there's also one in Salem, Illinois. And it discussed different programs they had. There was programs like counseling programs. There was different another program designed for somebody who maybe was affected by mental illness and had maybe lost their job and their life had pretty much fell apart and they'd let everything go. And this was a program to help people get back on their feet, establish themselves in a job, help them find housing, kind of rebuild their lives. There was different, like I said, counseling programs, not only for individuals, but group counseling, different things where people could go and meet each other and kind of to collaborate upon their thoughts and talk to each other about their feelings. And I wanted the Marion County Health Department members to learn that there was different programs like that available, because I had heard of the Community Resource Center and different local resources, but I never knew what they offered. There was a lot of different resources on that not the pamphlet, but on the handout I gave them that was for mental illness, was pinpointed towards mental illness that they'd never heard of. Like, there was a place called the Henry Center, and one lady said, well, I've never heard of this before. And another one said, oh yeah, it's in Centralia, it's, you know, down the street. And so it was something that made people more aware that they have more than just the Community Resource Center or the Angelus Center that connected to St. Mary's, which is what a lot of the population or the audience members that I talked to, they considered for mental health resources. So there was way more than that, and I thought that was good to open their eyes towards what was available besides just 2 places. Let's see. And then after I did my handouts and my pamphlets, I also had each member fill out an evaluation form. So my evaluation form, it basically assessed my introduction to my presentation, the knowledge within my presentation, me as a speaker. Did I seem like I knew what I was talking about? Did I include everything that was relevant? Did the information that I provided within my presentation, was it something that they felt like they could apply towards their practice within the health department and that they could use when they were caring for another person who may be undiagnosed with mental illness? And then also on the handouts and then on the pamphlets, was that something that they felt that they could use when they were taking care of these patients, something that they could use as a proper resource? I actually have one of my evaluation slips here. I'll show you. And I'm also going to attach a copy of it as well as the handout and the pamphlets, a picture, because I had gave my originals to the health department because they wanted them as a future resource in case they had a patient they needed help treat. So one of my comments on here, because I also had a comment section, I had everybody within my audience, they rated it like excellent, satisfactory, needs improvement, and then I had a comment section. One of my comments towards the end was, great job, will really help us within the community. This kind of made me, I really liked this because that was my goal in my presentation. The more research I had conducted towards the presentation, the more I kind of got into my presentation and wanted to be able to teach back towards the members of my audience. I had a lot of good feedback. It was a very good experience. I feel like the public health department within Marion County, I feel like they appreciated the time that I took out to conduct all this research, and as well as the resources that I made available and provided to them. We had a discussion towards the end as well where we could talk about anything that they felt was relevant towards the presentation, whether there was questions. I had one male participant within the audience, and he had voiced to me that every time he goes to the doctor, he feels like his doctor does a mental health assessment, and no one else said that they felt like their doctor did. But one lady said, well, I think my doctor assesses me just by asking me how I'm feeling. But I think sometimes, you know, we discuss how do we know when someone asks how we're feeling, whether they're talking about physically or they're talking about mentally. So we kind of got to go into depth about that and how even physicians and how other people can even assess for mental illness. I also felt like with the conversation that took place after the presentation, I felt like it kind of sealed it for me that my members in my audience, they actually were interested in the presentation. I feel like they paid a lot of attention because they did ask me questions and then they did engage in conversation after. I will conclude with some of the recommendations I would have for anybody who would like to do this project in the future. The big thing that I seen as kind of a limitation for me was that there wasn't a lot of information based on Marion County. I couldn't find anything towards Marion County, even on the web, and I had to base all my information off of state, and national. Well, that's not very good whenever you're pinpointing Marion County, which is a smaller, basically compiled of smaller communities. So if I were to do this study again, or if you were going to do this study, I would recommend you maybe do an anonymous survey of people aged 18 years and older. You could maybe do this survey at different portions of Marion County, whether it be at different health fairs, different bigger places of employment, whether it be like factories or maybe like different colleges where there's different members that may be coming in from Marion County that are age 18 years and older. I would also recommend maybe even conducting another study. There wasn't a lot of studies out there based on mental illness, as well as treatments that weren't having to do with medications or something nurses couldn't do, like stuff like that nurses really aren't in their scope of practice. One thing I would have liked to do if I would have had more time is even do like an exercise program. I found one about a walking program about how increased exercise helps improve one's attitude and one's feelings, and how different programs like this, if you pinpoint it towards more people with mental illnesses and undiagnosed, they're not going to feel like outcasts because there's people like them. And then these programs, they help people learn about different things that they've did in the past to overcome these barriers and treatments, and how they can help each other out. Another thing I found was there wasn't a lot of studies about the barriers and how to overcome barriers. I kind of felt like I had to spread out upon a lot of the information I found towards the one main barrier, which was the social stigma. That was my main study towards barriers. There wasn't a lot out there about lack of knowledge or transportation or cost. So I would probably seek more information, or even maybe go to like local doctors' offices and ask doctors, hey, do you do a mental health assessment, or find transportation. Maybe there's a South Central Transit in Centralia. Ask like, where all do you pick up patients in order to take them to the doctor? Do you go to this smaller community? Like, kind of where's the transportation range last? So to see what kind of transportation was even available for people who maybe didn't have vehicles. Different things like that. Otherwise, there really wasn't anything else I would change. I thought it was a good presentation. I thought it was effective. I thought there was a lot of learning and social interaction engaged in it. And honestly, if you have any other questions, I will be more than happy to answer them. And I thank you all for watching my video. Thank you.